One of the other little techniques that we use is we took from the dental field. You know, you ever been to the dentist? You know, when you get done having your dental cleaning, what do they hand you at checkout? They hand you your next appointment. They haven't asked you. They've given you your appointment slot, because we know in dentistry, if you fall out of that loop, you know, you might be months before you get back in. So we basically said, well, the doctor's made a recommendation for dental. I went ahead and took the liberty of scheduling your appointment. And at that point, most of the clients will look at it and say, okay, great. They never question it. So it's already locked in. It's in the computer. It's loaded. It's done. Okay? And that's one of those things, instead of saying, well, we should think about getting a dental. Let's do that right now. Okay? And that's all that ever happens, is we think about the dental. The compliance studies that AAHA did show conclusively that what we think we've recommended, we really didn't. Because the clients, you know, and we're thinking, well, they didn't accept it because they didn't want to pay for it. Well, the owners are leaving because they said, well, he said something about it, but he never really recommended it. And so we've taken a step further. We'll go ahead and make it. Now, if the client says, oh, I can't really make that, we've coached the technician and say, oh, well, then what would be a good time? Well, maybe not this day, maybe Tuesday, because we've made the assumption they want to come in. Okay, we've already made the assumption. So we're going to give them the option to tell us what another alternative date will be. If they say, well, I don't know what my schedule is, and they say, okay, well, I'm going to leave this one on here. That way we've got you in a slot, and then I will call you in a week, and we'll get it rescheduled. Or if you want to call beforehand and I see it's been switched up, then we'll be fine. But we're going to let them know that this is really important. Now, if we get a client that says, I really don't know, I'll get back to you, then we have a treatment code that says recommended dental in 2 months, which means they're going to get a postcard, 2, 4, 6 months, depending on what we set it up as, again, to touch them and retweak them on that recommendation. We're not going to let them forget.